Egg.
Blah 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 flow. Blah 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 flow. Blah 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 flow.
Blah 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 blah. You're welcome once again to the Dandy Health Show, and speaking to you is the Dandy Dan. Today is another special day, as we normally bring it to you, giving you health education and letting you know how to keep yourself from illness and disease so that you can stay healthy always. Alright, if you are new to this platform, go ahead, click the subscribe button, click the bell. If you like the content, give me that thumbs up. Yeah, thank you. Alright, as I said, look at this question. What if men had to menstruate? Oh, that would be too much. Or what do you think? Put your comment down in the comment section and let me see what you think about it. What if men had to menstruate? You know, women are created for this, and they are specially designed, specially created so they can fulfill a particular purpose. God specially designed them. You know that there is a conduit constructed majorly for women, a lonely path laid down for ladies, and a track tinted for girls. As far as feminism is concerned, they can't do without it. Part of it is what? Menstruation. And what is menstruation? Do you know menstruation? Some will like to know. Let me let you know.
Menstruation, also called having a period. As girls get older and their bodies change, they get their periods. The uterus is the part inside the body where a baby grows when a woman is pregnant. The inner lining of the uterus supports and nourishes the developing baby. If there is no baby, the lining is shed during her period. During a period, blood and other tissue from the uterus leave the body through the vagina. A period can last from a few days to about a week. You may have heard doctors talk about the menstrual cycle. This is the time from one period to another, usually about 28 days. Day 1 of the menstrual cycle is the first day of a period. The uterus starts to shed its lining. As soon as the period ends, the uterus prepares again to receive a fertilized egg. Eggs are released from a woman's ovaries. Eggs are super tiny, 1/10 the size of a poppy seed. Women have 2 ovaries, one on each side. The fallopian tubes lead from each ovary to the uterus. In the middle of the menstrual cycle, an ovary releases an egg. After ovulation, the egg travels down the fallopian tube. It takes a few days to complete the journey. Meanwhile, the lining of the uterus gradually gets thicker so it can support the development of a fertilized egg. If the egg gets fertilized, it will implant in the uterus and the woman is pregnant. If the egg is not fertilized, the woman is not pregnant and the egg will begin to dissolve. Because the woman is not pregnant, the lining of the uterus is not needed. a woman will have her monthly period, and the cycle begins again.
Alright, knowing menstruation now, you can have your period, which is also menstruation, without pain, without panic. You can menstruate without any mess up. Yeah, you can have your menstravaganz menstruation without any ills, without any aches, without any problem. Yeah, so that is why we want to pontificate period in this pandemic period, and we want to explain how you can menstruate without mess up. Male female menstravaganza. Menstrual Hygiene Day is the day as designed by WHO and UNICEF and other non-governmental organizations, but it is very much better. I choose to use Menstrual Health Day because menstrual health is more encompassing than menstrual hygiene. What is the difference? The difference is that menstrual hygiene culminates the immediate care that ladies have to put up all those gimmicks, washing, cleansing, changing, you understand, that female have to put up to maintain their period, to manage their period in an hygienic way that won't lead to maybe infection or having a kind of mess up or smells, or you understand. Yeah, so that is why we are explaining this. So talking about menstrual health is more encompassing, it's more broader than menstrual hygiene, in the sense that it pontificates or explain the healthiness and the maladies that is related to menstrual management, menstruation and management of period, rather than just the resources, availability of resources that you use just to maintain immediate cleanliness. That is the difference between the two. Menstrual health is more encompassing, and I choose to use Menstrual Health Day, World Menstrual Health Day. Alright, as you have known the meaning of menstruation, what is menstrual hygiene? It's just the term that describes women and girls cleaning up themselves with materials, absorbing materials and reusable materials to collect menstrual blood that comes as a result of shedding, what we learn in menstruation there, that is necessary to maintain that very process in a very clean and neat way, so that there won't be infection. The facilities, the materials being available, that is menstrual hygiene. Having the materials available and using it to clean themselves whenever they are having their cycle on every monthly basis. That is menstrual hygiene.
Hygiene needs of women and girls are often overlooked or not considered at all, mainly due to humanitarian staff and decision makers lacking knowledge of the risks and impact on women and girls if their needs are not met. So what is menstrual hygiene management, or MHM? It's about making sure women and girls can privately, safely, and hygienically manage their monthly periods with confidence and dignity. An estimated 26 million women and girls around the world are displaced right now, disrupting how they manage their basic personal hygiene needs. In recent years, efforts driven by the IFRC and other humanitarian actors have strengthened understanding and gathered evidence on MHM. Here are some of the challenges and actions needed to effectively respond to menstrual hygiene needs. Girls may get a mix of practical information, superstitions, and cultural beliefs before they get their period, or no information at all on how to manage it and stay healthy. Clear and factual information on the menstrual cycle and good hygiene practices need to be provided. During any distributions, demonstrate how to use, care, and dispose of personal items. Taboos, social norms, and misconceptions, especially around blood and sexual health, may limit women and girls from discussing their needs, influence the types of materials used, and can complicate disposal and cleaning. Engage with women, girls, men, and boys about their experiences, preferences, cultural beliefs, and challenges with MHM, and work together to address these. Bloodstains on clothing and worry about menstrual leaks can prevent or restrict girls and women from daily activities. Consult directly with women and girls on their preferences and make sure they have continuous access to essential items, as well as pads and underwear. Distribute items to support washing, drying, and disposal. Finding a private, safe, clean, and easily accessible toilet and bathing area can be difficult and may contribute to increased risk of sexual and gender-based violence. Ensure that private and safe toilets, washing, bathing, and disposable facilities are available and that women and girls feel comfortable to use them, paying close attention to culture, proximity from housing, lighting, and solid waste. Menstruation is a very personal thing. All of these components and actions are influenced by individual preferences, age, sociocultural context, and barriers, like lack of water. These core actions ensure a holistic approach to addressing the three essential components of MHM support to women and girls: access to materials, private and safe facilities, and information. That's why male and female volunteers and staff need basic knowledge about menstruation, as well as the confidence to talk about it and advocate for it, so they can involve and engage with women, girls, boys, and men right from the beginning, and continuously monitor the use, satisfaction, and challenges of women and girls, including following up after any distributions in both formal and informal ways. Based on all this feedback, staff and volunteers would revise activities so they can continue to address the changing needs of women and girls. Because working together, coordinating with others, and sharing our lessons with the humanitarian community is the only way to ensure that in the future, menstrual hygiene needs of women and girls during crisis can be properly addressed. Always.
So women understand what I'm saying, and going about menstrual hygiene norms, if these norms are not followed, what happens? It can easily lead to infection, because if you use one pad for the whole day or just two pads for the whole day, is too small, and whenever blood start to decompose, attract bacteria feast on it, and bacteria will have access to move up the reproductive tract and then cause infection, it kill the normal floras there, and then a lot of things can happen from there. So it is very advisable for you to use at least to change your pad at least 6 hourly. Every 6 hours you change your sanitary pad. It is good for you to make sure that the pubic area is cleansed up. Get rid of it. If you get rid of it, then there won't be blood and blood products being trapped by the ear. When blood products of menstrual blood is being trapped by those pubic ear, it attracts bacteria and it enters, move up to the reproductive tract, and it can cause infection and all what you don't want, itching and the like. So it is very good for you to shave off all those hair, dispose the pads appropriately. Don't just throw it inside the can, wrap it inside the maybe unused newspaper, then dispose it appropriately, rest, clean up, eat good food. So those are the menstrual norms, and there are also some challenges that faces menstruation. And part of the challenges is that there is, especially in this environment, in this climate in Nigeria, there are a lot of challenges. Go to many places, rural area, visit their public schools, public primary schools, you see that it is highly unacceptable, and girls there in such an environment won't have access to all these things. They won't have access to good toilets, good water to maintain their menstrual hygiene. And apart from the water facility, toilet facility, safe, clean environment, safe private place to use for changing up. Another thing is,
hi everyone, my name is Suri and I would like to share something with you today. I noticed that my body has been changing lately and it's all been quite confusing for me. My chest seems to have gotten bigger. There is hair between my legs. And I woke up one morning and found that there was blood on my bed. I was a little bit scared and asked my mommy what was going on.
Suri, don't worry. Everything that's happening to you is something every girl experiences. All this just means that you're on your way to becoming a woman. When you see blood coming out of you, it means that you're having your menstruation or your period.
Why does this happen, Mommy?
The reason why you have your period is because your ovaries are waking up. Girls and women have 2 ovaries, and each of the ovaries hold thousands of eggs, which are really tiny, nothing bigger than the size of a pinhead. During the menstrual cycle, an egg is released from one of the ovaries and begins a trip down the fallopian tube to the uterus, which is also called the womb. If the egg is unfertilized, the unfertilized egg and the lining from the uterus leave the body, and therefore the girl has her period.
Mommy, what happens when I get my period? Is it just blood that I will see?
Well, Suri, as your body is changing, you won't just see blood. Sometimes you'll feel tired, and you might also feel some pain in your breasts. You might also experience menstrual cramps, which will feel like pain in your tummy. All of this is normal when a girl is having her period.
Mommy, how long will my period last?
You will typically get it once a month, and it will last between 3 to 7 days. The intervals between each period is usually 21 to 45 days, typically 28.
What do I do, and how can I take care of myself when I'm having my period?
As a woman, it is always important to maintain good hygiene, especially during your periods. This is because bacteria can go into the vagina, and women who do not take care of their hygiene will be very prone to infections. Let's look at how we can keep ourselves clean. First, we have to keep the external area of the vagina clean. That means washing from front to back with water and mild soap regularly. This is not only good hygiene, but it may prevent you from getting a urinary tract infection. Drinking plenty of water helps your body stay healthier too. Secondly, when you're having your period, you need to wear a sanitary pad because it will soak up the blood that leaves the vagina, and it is hygienic as each pad is individually wrapped and it is not reusable. Now, let's see how to wear a sanitary pad. Make sure that the individual packaging is removed and unfold the pad. Peel off the layers to reveal the sticky strips. Next, you should press down the pad with the sticky side on the bottom in the liner of your underwear. Remember to change your pad before it is soaked up with blood, or change it at least 2 to 3 times a day. Also, remember to wash your hands before and after use of your sanitary pads. One more thing to remember is never stuff a sanitary pad down the toilet. wrap it up and dispose it together with all other trash.
Mummy, I've heard some of my friends say that when I have my period, it means my body is getting rid of bad blood. Is that true?
This is not true at all, Suri. Having your menstruation is a precious thing. This means that a woman, when she is ready, is able to have children and to nurture the next generation. You should be proud that you're becoming a woman and never feel shameful about having your period.
Okay, Mummy. Thank you for explaining this to me. I feel much better now.
And Suri, don't ever be afraid if you need to ask any more questions.
Okay, Mummy, I will. Thank you for listening to my story, everyone, and I hope this helps you understand your body better.
Menstrual health is a state of complete physical, mental, and social well-being, and not mere absence of diseases or infirmities that is related to menstrual cycle and menstrual period. You know, there is this dichotomy or misunderstanding about menstrual cycle and menstrual period. Something is the same thing. Menstrual cycle, menstrual period. Can we just say something about it? Menstrual cycle is just the cyclical phenomenon, monthly interplay, monthly interplay of hormone that gives you ovulation, and then the menstruation comes down. That is menstrual cycle. But menstrual period is a period of days that you used to bleed. That is menstrual period. That is the period. Okay, the cycle is the interplay of hormones that culminates the cycle, and each cycle, average cycle of a woman is 28 days, but we can have from 23 to 41 days. Okay, and the normal period is between the average period is between 3 to 7 days. Okay, then we have talking about menstruation. 50 to 75% of menstrual flow is blood. The rest is just fragments of endometrial tissue. So normally menstrual blood is supposed not to clot. I'm saying this so that you can know if your menstruation is abnormal. You'll be able to understand. That is part of menstrual health. That is what menstrual health entails. It is different from menstrual hygiene that is immediate. But if you know the whole gist of it, you know, okay, this thing is becoming abnormal, then you what? Go to your doctor, to your physician, and they assist you to fix it up. Okay, as I said, menstrual blood ought not to clot. If your menstrual blood is clotting, then something is happening, because the endometrium has a good amount of fibrin, and whenever a blood starts to clot, that means that there is a kind of little substance that allow much of blood to culminate together, and then there is clotting. Okay, then these are common social menstrual malady. I may not be able to tackle everything now, but in my subsequent video, I'm going to tackle what people or what women normally have challenges with most. I can tell you what they have challenges with most, because I have the experience dealing with them very well. One is the bleeding irregularities. Two is infection. In fact, infection is the number one. It is very, very common. And if you don't manage your menstrual hygiene very well, just as I said previously, definitely infection can set in, although that's not the only means by which infection can comes up. So the first one I'm going to be talking about is premenstrual syndrome. Premenstrual syndrome, PMS, is just a condition that affects women, change their mood, change their emotions whenever they approach their ovulatory period. Whenever they are menstruating, immediately after menstruation it stops, and some few days after menstruation it stops. What happens then is that their emotion change, their behavior can change. They can be somehow aggressive, somehow nervous, they can be somehow moody. So this is what we call premenstrual syndrome. It affects more than 90% of menstruating women. Male watching me, have you encountered women like that? Yes, women also can testify to that. Okay. Premenstrual syndrome starts 5 to 11 days before menstruation, and that's typically, some can just few days after menstruation before it stops. Okay, some can linger some days after. So what causes this is just the major cause is unknown, but with research it is found out that estrogen and progesterone, they are the major cause that normally initiates mood swing, and then some other hormones like serotonin can also have part to play. Another issue that female or women are always concerned about is pregnancy. Yeah, many people are, if once they missed one month of their period, oh, am I not pregnant? They quickly go for pregnancy test. That is one of the psychological effects of it. And whenever the fear of am I pregnant, am I not pregnant is setting in, once you know that you are married, then if you are not ready for pregnancy, contraceptives are available in different form. Just speak to your physician, speak to your health professionals, and they are going to fix you up with one that will be good for you. All right, if you are not married, abstinence is the best. Join me next time on the Dandy Health Show. Don't forget, go ahead, subscribe, click the bell beside it, click all beside the bell, and then share the video. Give me a thumbs up if you like the content. Thank you for watching.